I'm graduating as a marriage and family therapist this week, so I wanted to answer this question that I've been getting while I've been in this program the whole time. And that's, why did you choose marriage and family therapy versus licensed social worker, licensed alcohol drug counselor, licensed clinical professional? Why did you choose the MFT program? So, first and foremost, I never wanted to be a therapist. Okay. When I graduated and got my bachelor's degree in psychology, I did not think that I was going to be getting my master's in anything. I did not want to go back to school. However, once I got my degree, continued on in the field with a bachelor's degree in psychology, I realized quickly that there was not many opportunities with just a bachelor's degree in psychology. So I started to look into different master's programs, and this was back in 2016. After working in the psychology field for a few years, I realized that being a therapist was completely different from what I thought it was in my head. So I started looking up the different type of therapists and which one resonated with me. So we had the social work perspective, we had the alcohol and drug perspective, we had the licensed clinical professional perspective, we had the licensed marriage and family therapist perspective. From those, I decided that marriage and family therapy resonated more with who I am as a person. I really think it's important when you're looking for any type of career or you're trying to pivot into something different in your life to always make sure that it's something that resonates with you and that you're passionate about. So I grew up with both of my parents, and not only did I grow up with both of my parents, but I grew up seeing a healthy relationship my whole life. That inspired me to want to help other people who may not have experienced the same thing. Not only that, marriage and family therapists have a different perspective versus some of the other disciplines. Marriage and family therapists study the relationships between people, and not just romantic relationships. I'm talking about any type of relationships. And not only do we study the relationships, but we study the patterns. Another interesting thing that we do as marriage and family therapists is create what's called genograms. And it's when you draw out three different generations of families and you can connect the dots and see the patterns and see the dysfunction. And it's actually pretty interesting. Marriage and family therapists also go into some specialties that I'm interested in. And one of those specialties are couples therapy and sex therapy. Marriage and family therapists don't focus so much on symptoms and pathologizing everything. We study everything from a systemic point of view. And that means we look at all the different factors around an individual that could be affecting them. And not only can we conduct family therapy, we can conduct individual therapy as well. So I chose this route because I thought about myself, who I am, and how I wanted to move forward as a therapist. I thought about the perspective of an MFT, and I thought about my future and how I would want to move forward as an MFT. And as I got into the program, I realized that I really like working with couples. So now I want my specialty to be couples therapy and sex therapy. And as I've continued on, I realized that intimacy is another thing that I want to specialize in. So, if you're thinking about being a therapist, know that there are several different types of therapists. You want to look into what they do, what their perspective is, what their approach is, and how that particular approach may resonate with you.